Warning, this is a story that involves pregnancy loss. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OB GYN who's had the privilege of helping hundreds of moms bring their babies into this world. I'm here to help you be knowledgeable, prepared, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at ncrcoaching.com/disclaimer. Now let's get to it. Hello and welcome to another episode of the podcast. This is episode number 80. Thank you for being here with me today. On today's episode of the podcast, I have Cortnie. Cortnie reached out to me on Instagram when she was pregnant with her second baby, telling me how excited she was that she found me. However, unfortunately, not too long after she reached out to me, Cortnie received the news that her baby had trisomy 13. Trisomy 13 is a condition where a baby has an extra chromosome 13. It causes severe intellectual and physical disabilities. Most babies with trisomy 13 do not survive beyond the first week of life. And if they do live beyond the first week of life, 90% of them will die within the first year of life. It is a rare condition. It affects about 1 in 10,000 pregnancies. Now, Cortnie wanted to come on and share her story of how she managed this devastating diagnosis. She is hoping that by sharing her story, she can help other women who may face a similar circumstance, because as you will hear, it was quite a traumatic experience for her, and she wants to do what she can to help it not be so traumatic for another woman who may be facing a similar situation. Now, as I said, and as you'll hear, this was an incredibly difficult and at times painful process for Cortnie, and it is a true testament to her bravery and her strength that she could come on and share her story, especially so soon after it happened. It hasn't been that long since all of this transpired. So let's go ahead and get into Cortnie's story. Thank you so much, Cortnie, for agreeing to come on the podcast. I know this is an incredibly difficult thing to talk about, and I appreciate your strength and your bravery coming on to talk about it.
Well, thank you. And thank you for the platform. I know myself and many other women, are looking for advice, especially from a specialist in terms of like this process. So it's been refreshing to have your podcast.
Oh, well, thank you. I appreciate that. So why don't we start off by having you tell us a little bit about yourself and your family?
Yeah. So, I've been married. My husband and I got married when we were around 33. So very late in terms of the whole pregnancy thing. I guess women don't really think about that.
Right.
So we met. We both were in education, met there, had a beautiful wedding, and jumped right into our first pregnancy. So we have an almost 3-year-old running around the house. So it's been fun just going on this journey and just really looking to expand our family quickly before we hit this 40 milestone.
I know exactly what you mean. My husband and I'm 3 years older than my husband, but I was 31 when we got married. So definitely know about that later start.
Yes.
So we're going to hear about what happened with your second pregnancy. So how did that pregnancy start out for you? Was it planned? Were you excited? I'm guessing yes, but just tell us a bit about that.
Yeah. So we wanted to wait at least 2 years before embarking on this second pregnancy, just to give our 2-year-old a chance to, have that lovely only child syndrome.
Sure.
So we started trying around, I want to say September, but it wasn't happening. And it was just like very frustrating because with the first child, literally, we were like, all right, let's do it. Bam, we were
Mm-hmm.
pregnant. So with the second pregnancy, it did take longer. In fact, I got to the point where I stopped taking pregnancy tests at home, and just because it just became like so definite, like, no, you're not pregnant. And I just allowed the, cycle to either come, and it did. But we finally got our first positive in January, and we were very excited. I mean, I honestly couldn't believe it. I'm like, oh my God, we've been trying. And I was calling a doctor, like, what's wrong with me? And she's like, nothing, it just may take longer. There's a 20% chance, blah, blah, blah. Of course, you don't want to hear that. So we were excited to, be pregnant with our second child.
Gotcha. So very much so excited and planned and ready for this pregnancy.
Absolutely.
Yeah. Yeah.
Ready. Yes. We
Yeah.
were ready.
And you were seeing a physician for your prenatal care?
Correct. And she's the same physician who delivered my first child. Really great OB, and really, really, really love working with her. And yeah, she was just as excited as well, especially since I was, calling the office, like, what's going on, and
Right.
trying to be seen. And so she was excited too.
Gotcha. So it took you
Hmm.
about 4 or 5 months. Is that right
Hmm.
to get?
Yes.
Okay. Which, it feels like forever. In pregnancy terms, it's actually not what we consider long, but I know what it feels like as well. Like after a month, it took 6 months for our second one. And it was, I mean,
Oh wow.
for our first one. And it was like, it feels like it's forever. Like, but in the grand scheme of things and medically wise, it's not dangerous, but I certainly can relate to like, when is this going to happen? When is this going to happen?
Right.
Yeah.
Clearly, we just can't control it all. And I was just thinking, like, we'll have a baby with this zodiac sign. And I was like, well, I guess
Right.
not. So,
Yeah.
yeah.
So then you get to the point in your prenatal care where you were offered genetic testing. So what was that kind of discussion like? Was it just sort of, here it is, this is something we recommend or offer? How did that go?
Yeah. So I got the same genetic test done with my first child, even though I was younger in terms of, this geriatric age, which I'm coined as now. So
That is such an
we
offensive
honestly,
term, by the way. Like, I don't know why we
it
say
is.
that.
Oh my gosh, I know, it's crazy. So yeah, it was just a no-brainer in terms of getting it. However, we were right in the beginning of COVID. So because of that, my testing was actually done a little later than what it should have been.
Okay.
So definitely got it. But because of COVID, I didn't get my it takes 2 weeks. And I don't know if I guess that's normal. And so by the time the results came back, it was just like, oh my gosh, and I knew it was something because my doctor shot me a text message like, hey, can you talk? And like I said, I've been going to her for a while. So something about the tone of the text message was like, oh my God, something is wrong. I just immediately knew. And, my husband and I were working from home. So I, yelled for him to come upstairs, not knowing, the news that she was going to give us.
Right.
But, we were both here to talk to her. And she told us, she was very sorry. But with that, she said that she just told us our options. I think she gave us like three. One, you can just continue on, and, just we'll continue to monitor you. Or the second option was to actually go get the second level of testing, and the CVS, to get that done, to either confirm it. and then the third, if we did find out that we had it, she just said that some women, decided to just continue on with the pregnancy even after the final confirmation. But, she did go into what that looked like and in terms of the success rate for the baby, and also the stress that it would wear on my body.
Gotcha. So she calls you and tells you that the baby has trisomy 13, correct? Was that?
Yes, yes.
And
That was detected in the blood test.
okay. And then she goes through all the options of ending the pregnancy versus continuing the pregnancy and versus doing another test to confirm it, even though the first test is pretty accurate. And what at that point did you decide to get a confirmatory test, or did you feel like you needed it?
Absolutely.
Okay.
Yeah, I did. Just because I don't know. She said that sometimes like there's a small percentage that the CVS may come back negative. So, my husband and I, we felt that there was a little hope. So right away, as soon as I hung up with her, I was on the other line making an appointment with a high risk doctor to get in as soon as possible to have this test, because that test, the results took an additional 2 weeks to come back in to, give us a little more into the actual genetics of the baby. So yeah, we were lucky to get in the next day.
Oh, nice.
Um,
Okay.
yeah, well, with pull from her to have the procedure. And again, this is, my husband wasn't allowed to go in. So, like, that was tough, going through the consultation in terms of like what they're going to be looking for, how they're going to administer the test, and the process of actually growing the specimen to then determine the DNA from that.
Gotcha. So you decide, because this is I'm guessing this is a desired pregnancy, something that you really want it. You want to be 100% certain.
Absolutely.
Yeah,
Absolutely. Yeah.
that something is wrong. And guys, just to kind of back up a little bit, CVS is chorionic villus sampling, and it's a procedure where a little piece of the placenta is actually taken in order to look at DNA, and it's the gold standard in terms of diagnosis early in pregnancy for any chromosome problems. And as far as trisomy 13, I'll just briefly say that it is a devastating condition for babies, and I'll link to some information in the show notes, but most don't survive, or if they do, they have significant long-term problems and difficulties. So when you heard that information and you had that time between you get the results, you quickly make this decision, you're going to get the CVS, but then you have to even wait, even though it was just a day, there's still this time that you're waiting. What was going through your mind, and what were you and your husband kind of talking about at the time?
Yeah, so we huge believers in spiritual. So we were really just, we were trusting in God that, like there's this thing that, you can pray for what you want, or, you can just ask God to just do what is best at that point. But with that, we were really just hopeful that the results were going to come back in our favor, and that we will be able to deliver another healthy baby. And even during the sampling, he wasn't allowed to come with me. But what happened, they also do an ultrasound, a pretty intensive ultrasound. Normally, the one that you don't get until you're a little further along. I cannot remember the name of
Oh,
it.
sure, like an anatomy ultrasound
The
or
anatomy, exactly.
yeah.
So as the doctor, was looking and, looking for some of the features that she said are normally, they stick out with trisomy 13. She said that the baby actually looked normal. They looked for like fluid behind the neck, the limbs, and, she was actually hopeful in terms of the scan that things were going to come back in our favor. So we held on to that faith, and, my mom did her research and she's like, yeah, you're going to be fine. Like this, just the fact that it doesn't happen a lot. I think it's very rare. So we were just hoping that things were going to come back in our favor.
Gotcha. Gotcha. And
Hmm.
your husband could not be with you during that
No,
appointment. Was
no.
he on video at all or on the phone or?
Yeah, so I did FaceTime him in during the consultation when she went into the genetics and the chromosomes and the pairing and what happens if there's an extra chromosome. So he was able to sit in on that, and then they also tell you the risk associated with sampling from your placenta, which she said that she'd never had any cases, but they always have to give you that disclaimer. But during the actual procedure, no, I didn't videotape him. I mean, that, oh my
Sure,
gosh,
sure.
very that was invasive because the needle that goes into you to actually pull out the sampling, it was pretty traumatic. But
Right, right.
yeah, yeah,
So, oh my gosh. Oh,
I know, and
that
I'm sure so many other women, that are giving birth during this time. It's COVID has really kind of shifted a lot of things. So
so that was just incredibly difficult. I just can't even
yes,
imagine. So then you get through that and then you have to wait another 2
2
weeks.
weeks.
Okay. And so
Yes.
at that point you're probably what, 11, 12 weeks along, somewhere around there?
I think 13.
13. Okay. Okay. Okay.
Yeah. So
And
we were in our second trimester at that
sure.
point. Yeah.
Sure. Okay. And then you have to wait 2 weeks and then during that time I can only imagine what's going through your mind. And
Yep.
were you ever thinking like, what did I do wrong? How did this happen? Or were you not at that point yet?
So I tried to stay away from that part at that time because, I'm still, praying every night,
Sure.
God, just allow this baby to be healthy, and really just trying not to let my mind go there. Even staying away from the blogs and the apps with the women who may talk about certain deformities or genetic issues that their children have. So I really just try to stay away from it and just keep myself busy at
Gotcha.
home.
Yeah, that makes sense. So
Yes.
then you get the final results back that unfortunately it confirmed that the baby did have trisomy 13.
Hmm. Hmm.
And then how did you come to the decision to decide to end the pregnancy?
Hmm. Yeah. So at that point, the quality of life. Yeah, when in undergrad, I work with youth with special needs, so I know that world very well. And honestly, this is something that even the children that I worked with didn't have. Most
Right.
of those children had cerebral palsy, but it was really just the quality of life. I would never. It was hard. I mean,
Of course.
to be completely honest, it was. I can say it was one of the hardest decisions that I've ever had to make in terms of resolving a pregnancy because I've been that person that throughout life was very careful about the choices that I made. I've never had to go into Planned Parenthood, which is totally okay, if that's your best decision. But I, tried not to have to make that decision and, tried to be very responsible in terms of making sure that the decisions that I made were at a good point in my life. So it was tough having to make that decision, and even tougher because my husband was in denial and he felt that the test was wrong. And I'm just like, baby, like this is science, and
Right.
there's one thing we really had to talk. in terms of like just the fact that, science has evolved and the fact that we were able to get this second level of testing and that these are the cards that we've been dealt. So either we continue or we end. And I knew that I did not want to put my body through the stress and emotional stress of having to actually deliver and watching, my baby suffer.
Right, right, right.
So, we decided, but there was this second layer that came along with that decision because I belong to a faith-based hospital. So with faith-based hospitals, they don't do procedures. They do not do DNCs unless the baby resolved itself on its own.
Right, right.
So now I had to, on top of all of the other stressors, find a reputable hospital that would take me. And I felt like if we had to do it, I at least wanted to do it with dignity for the sake of the baby. But it was tough. There are only 2 institutions that do it here in Michigan. And I called them, and because of COVID, they were not seeing patients unless mom had a health problem and couldn't go elsewhere. So I didn't qualify to go there. And they just kept pointing me in a direction of a family center. And I just could not it just wasn't for me. And, I just couldn't do it. And there was another hospital in Detroit with one doctor who did the procedure. So I was able to get in to see him. And, it's just crazy because I'm like, at this point, I wanted to just get it over with so that the baby, wasn't getting bigger and I was starting to feel kicking. But I did find a doctor, but it was tough even finding a doctor that would take me and do this procedure.
So you had to navigate this on your own?
Yes, yeah. And my doctor pointed me in the direction, but again, because of the hospital that she works at, she couldn't help with that second level.
Right. Oh my God. So on top of the stress of you've come to this incredibly difficult and hard decision, and then you have to add this extra layer of taking it upon yourself to get the care that you need.
Yeah, absolutely.
Oh my gosh. And in the middle of a pandemic.
And in the middle of a pandemic, and only 2 places in Michigan perform this procedure.
Right.
On top of that. Well, that's what I was told, unless.
Sure. Yeah. Once you get to be a certain point in pregnancy, it really should be somebody who's skilled and trained in doing so. So that doesn't surprise me.
Okay.
So then were you able to get with that doctor, like get in fairly quickly? And then how did that whole process go for you? And how far away was it from where you live?
Well, I'm not far from Detroit, so about 20 minutes out.
Okay.
So I was able to get in with him only because I had to pull strings, because my mother and my stepmother were both like, on top of all the emotions I'm dealing with, like they were trying to help me as much as they could in terms of like this next step. And I just didn't have the mental capacity. And so they were calling around, and my stepmother's longtime doctor friend happened to know this doctor and name dropped. And because of the name drop, I was able to get an appointment with him because I'm not even, with the hospital to even get in there. So I was able to get in there only because I dropped so-and-so sent me.
Right. Oh my
And
gosh.
I got in to see him.
Oh. And then how is he in terms of helping you through this and the compassion level and the staff and all of those things? How was it once you got to that point in the process?
Yeah. Well, I want to say he was very, very nice. Very nice guy. Just an older doctor, and you could tell that he's been doing this for a while, and just very straightforward. So different from my OB, but he did provide the information that I needed. However, it's just a little different when you select your doctor
Sure,
before
sure.
going in, you interview. So, but just very straightforward. Just like, well, this is how it goes. This is how it works, and yeah, basically you can come in either Friday or you can wait until Monday. So you can tell that this is just something that he does and he does often. But I did feel very comforted knowing that he was skilled in this area, that he performed this procedure for many women. And I was grateful that, he was going to help me
Right, right.
despite insurance not kicking in at all and me, having to dish out the money to even pay for it. But he was very kind.
Okay. And why didn't your insurance didn't cover it?
No, no, they did not cover it because it was second trimester and it wasn't considered. I guess they didn't consider it a procedure that needed to happen, despite the fact that
You had this
the study
diagnosis.
I've had it, the second layer of testing, and what we know about babies that are born with it was not covered.
Okay. So you had this devastating diagnosis. You have to find someone yourself to help with the procedure, and then insurance doesn't pay for it.
Not at all.
Oh my God.
Yeah. And then they said, well, if you come in, we'll need $1,000 today, and the rest of the money will be due on Friday when you come in. So they were very, straightforward. Like, if you don't have it, we won't do it. And I was just like, okay.
And
So
they knew the reason behind it? Of course they
they
did. Yeah,
knew.
of course they
Mhm,
did.
mhm.
Yeah. Oh my God. Okay. And did they offer you any type of emotional support did any like a counselor or
No, and I actually, because I didn't know how I was going to feel after, especially my husband couldn't come into any of these appointments with me. But no, they didn't. And I actually asked, like, well, is there something if I need, what can, and he was just like, well, I don't want to offer you any, opiates that will, and I wasn't really seeking for something to be addicted to, but more so help me cope with the pain, I guess, because I felt it, like this process was just not easy. And then I didn't have a lot of time to even really process it because, at this point we're going on 16 weeks.
I,
But no,
okay.
counseling,
Right.
no.
Did you see a genetic counselor at all during any of this?
So I was offered the help through my sister who works in one of their medical facilities. She does genetics with animals. So I know it's weird, but fun. So she connected me with someone who was in one of her master level classes who offered to get me an appointment. And this was before I scheduled the appointment with the doctor at. And honestly, Dr. Nicole, I thought about it, but I also felt like time was not on my side at this
Right.
point.
Right.
And I felt like anything that I did was going to delay it. And I didn't want to continue to delay, especially since it was so hard to get appointments.
Sure, sure. But even I guess in the very beginning when there was a suspicion, did your regular OB at that time offer to send you to talk to a genetic counselor about it?
No.
I I don't I'm sorry. I'm just having a hard time like wrapping my head around this because it just feels like you were just left to figure so much out on your own in a very very hard situation. Oh my gosh. Okay. No one said, like, it should be routine that when you have a diagnosis like this, that you should get referred to a genetic counselor. So and I'm not saying, I don't want to, like, obviously you have a good relationship with your OB, and I'm not trying to trash her or him or
No,
anything like that.
absolutely.
Yeah. It's just
Absolutely.
that, and I don't know if it's the resources or what, but wow. Okay.
And even to that point, I felt that the high risk doctor, should have gave me more insights, but it was really just a call with the diagnostics of the diagnosis, and that was it.
Yeah.
I
That's
didn't even
another, yeah.
receive
Even the high risk
next
doctor.
steps from her either. No, I didn't receive next steps. Like, she just said, I'm sorry, you can try again after your first cycle comes back, and I will see you early on if you would like, to do this screening earlier. And that was it. I didn't even get recommendations in terms of where to go from that call.
Okay. Wow. I'm so sorry you had to go through that. I mean, I feel like that's inexcusable.
Yeah.
That our system failed you in such a vulnerable and hard time.
Yeah.
Yeah.
Yeah. And I didn't know, I researched, and again, which is why I wanted to share my story
Yes.
seriously, so that women do understand, because this is new to me right now. So, I really, my prayer is that someone, this could be, useful. But no, I was not offered a genetic doctor to even talk to me about what that meant, and if it was just a mutation that occurred, and if it has something to do with my husband, or we don't have any known, you know, genetic disorders in our family. So this was really just, we were surprised.
Sure, of course. Of course. Okay. So you're finally able to get the procedure scheduled, and it sounds like gratefully you have the means to
Yeah.
pay for it. Even if it may have been a stretch, or maybe you have family, or you were able to pay for it. How? And I don't want, I don't want you to relive any of the detail, because I know it's very difficult. But I guess just in general, how was the process of the procedure?
Yeah. So they put me completely under. Well, I'm sorry, there was a two-step. So I went in the day before the procedure, and I'll pause and let you explain, because the terminology, where he inserted something into my cervix
Yeah,
to,
maybe something called laminaria, in order to
yeah,
help your cervix open up. Yeah, so help your cervix dilate slowly over that day, so it wouldn't be as difficult to do the procedure.
yes.
Yeah.
So I went in the day before, and that was emotional, because walking in, it was just like, that final, we were doing it, and I felt like it was so final. But and then went in the next morning, and yeah, they gave me the whole anesthetics to knock me out
Right.
completely.
Right.
Anesthesia, I'm sorry. Yeah, and I woke up, and it was, it was
It was
over.
right.
And
Right.
yeah. Mhm.
Okay. 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 And then how did you recover from it? Did you get back to yourself fairly? I
Yeah.
should say physically. Physically.
So physically, and the doctor explained that the hardest part was actually the night before. But after that, I felt, the next day, the only pain I had was in my throat, strangely, and in my neck. So I don't know. I was just like, what were they doing?
Yeah, probably from
Um,
the tube that was down your throat. Yeah.
Absolutely. But other than that, I did take 2 weeks off to mentally get myself back, and found a project to do around the house to just keep me focused on something. So yeah, the recovery was very easy and
Okay.
simple.
Okay.
Yeah.
The physical recovery at least.
The physical
Yeah.
recovery.
Yeah.
Yes.
So how did you and your husband grieve the loss of your baby?
Yeah, we we did just that, we just let it out and we talked about it, and we still pray, for we call her our little angel, and
Right. Did you name her? I mean, you don't
still
have to share the name, but did you name her?
we
Yeah.
did, and
Yeah. Yeah.
yeah, so we literally we went through the process in terms of together. We talked about it together. The good thing that COVID did do was we weren't out. So I didn't really have to go and tell everyone, hey, we lost the baby. And
Right.
because we really weren't in contact with so many people during that period of time. And, again, we felt that peace with our decision, and it's still a process.
Of
We
course.
still have our moments that come and go, but our 2-year-old quickly brings us back to reality in terms of like, hey, I'm here. But yeah, there are still moments. And his thing was like, I want to try right away. And I'm like, well, hold on, brother.
Right. You like, I need a minute to kind of
I need
like,
a minute,
right.
seriously. But yeah, so it's definitely, there are those moments, and I'm sure everyone may go through that differently, but my support system in terms of my mother, my sister, they broke all the rules in terms of coming over during that time to hang out, and be with us as much as they could. And my grandma was sending care packets and food, and just really trying to love us from a distance.
Right.
So yeah.
And do you feel like you had any support at all from within your, like the healthcare system, your doctor's office or the, it sounds like no, but was there any like follow up or have you seen a counselor or anything like that?
No, I haven't seen a counselor. My doctor did call me the day of the procedure and after to just kind of check in to
Sure.
see, how I was feeling. And I actually decided to do my follow up with her over the other doctor because I just couldn't imagine walking back into the office.
Yeah. Yeah. Yeah.
So just the association with his office, just but I did see my post care with her. But no, I haven't talked to a counselor.
Okay. And this is this is very recent within the last couple of months that this happened.
Yeah, May 8th.
Okay. Okay. I this is, I mean, looking back on everything, how do you feel about the decision you made? How are you feeling right now?
Yeah, so well, this is the first time, so just that I've talked about it since the grieving process with my family, my mom.
Right.
Like I shared all of this with her,
Right.
and she was calling. She really wanted to get inside to see how I was feeling, and the moment that I said, I feel like I'm killing our child, she immediately stopped and said, hey, you can't look at it that way because the baby is not healthy. And and I think that helped in terms of me knowing that the decision was made to just not have to see our baby suffer. And that's really the thing that I hold on to in terms of the comfort, is just knowing that our baby didn't have to suffer.
Right. 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 So
This
you really
yeah.
wrestled with that
Yeah, oh my God,
that
are you kidding me?
that you
Yes.
felt like you were killing
Oh,
your child.
oh yeah. Oh gosh, yes, absolutely. And yes, and my husband's family, who they're very Bible based, and they had their thoughts in terms of the decision. And I just didn't have the capacity to deal with it. And I told him, I just didn't need to know what was
Right.
being said.
Right. Right.
Again, like this was not something that I wanted to do, let alone to hear anyone else's opinions towards the decision that we made.
Sure. Sure.
Yeah.
Sure. Oh,
So, but yeah.
this is so incredibly hard. And I am so grateful that you have shared your story, because I know that it is going to help someone hearing it. I'm 100% confident of that. And you are so strong. I cannot say that enough.
Thank you. Thank you. Thank
Yeah.
you.
So if you wanted just to wrap up, what is one thing that you want every woman to know after you have gone through this experience?
Yeah, I guess it's really just to go for what your heart says. I do believe it's a decision that only a mother can make, whether to, continue. And I get that some women may want that closure. So my advice or last piece is to just really, do what you feel is best and be okay with that. And be okay with that. Seriously. This was just the choice that we made, and yeah. And definitely the genetic testing is very important. Especially the earlier you can get it, definitely do it. That way, you will know what's going on in terms of, you know, your baby.
Right, right, right. And then I guess one more question. Do you think you will try and have another baby at some point?
Absolutely.
Okay,
Yes,
okay,
absolutely. Yeah.
okay, okay.
Yes, we're not gonna leave our little Miss Logan to be a single child, only child.
Right, 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 right.
So absolutely.
Gotcha.
I'm not gonna stress or worry about it. We're just gonna see what happens, and I do feel confident that we will be fine. And that was another piece of information that I did get that was reassuring in terms of, a lot of women, are able to get pregnant again and have completely healthy and normal pregnancies after dealing with trisomy.
Yeah, most of the time. Yeah, absolutely. Well, Cortnie, thank you so much for agreeing to come on and share your story. Like I said, you are so incredibly brave, so incredibly strong. I so appreciate it.
Well, thank you. And thank you for this platform. And I am confident that I will be back at some point, and there will be a good story to follow up about an easy pregnancy and healthy. So I will make sure to keep in touch with you and continue to listen to this amazing platform that you've created for women.
Well, 100%. You have an open door invitation to come back.
Yay! Awesome, awesome.
All right. Wow. Okay. So, what an incredible story. What an incredible testament to Cortnie's strength and bravery. I know that was really difficult to hear, and I'm sure it was infinitely more difficult for her to tell. So, I really appreciate her taking the time to come on and share her story with us. Now, after every episode where I have a guest on, I do something called Nicole's Notes, where I talk about my takeaways from the episode. And here are my Nicole's notes from my conversation with Cortnie. So the first thing I want to say is that so much about Cortnie's experience was wrong. We as a healthcare system really failed her during such a difficult time. A woman should not be left to navigate this type of situation on her own. And I'm really deeply sorry that she had to experience this. What should happen when you realize that there is a problem or an issue with a pregnancy like this? You should see a genetic counselor in order to get a full picture of what the condition entails. And then once you make a decision about what you want to do, and then the options should be reviewed. And that's whether you decide to continue the pregnancy or not. Once a decision is made, we should provide you with resources and support to help you through it and not figure things out on your own. That can include setting up appointments, recommending a counselor to see, connecting with specialists, maybe even connecting with other moms who've been through a similar circumstance. And then, of course, you should not have to pay for this out of pocket. No one should have to pay for any of these things out of pocket. That's just, incredibly crazy to think that that's what happened, or that anyone would have to experience that circumstance. It can be difficult to coordinate these types of things just because of the way our healthcare system is designed. It's rather fragmented, actually, but it can be done, and it's how it should be done. And just because it's difficult, that doesn't mean that it's something that we can't do. And then the second thing I want to say about this episode is that ending a pregnancy is not infrequently a very incredibly difficult decision for women. And in some states, there are laws where Cortnie would have had to have a forced waiting period before proceeding, or she would have been forced to see the baby on ultrasound or hear the heartbeat, which you can imagine could have been quite traumatic. And this story is an example, or exemplifies, why I believe politics has no place in this arena. Women are quite capable of making the decision for themselves about what happens in their own bodies and with their pregnancies, and the government does not need to interfere with that. And I also really dislike it that this is often framed as a pro-life, pro-choice debate. I actually find it quite offensive that because I support a woman's choice to decide what happens in her body, that somehow I don't have a commitment to life. As an obstetrician, and particularly one who is a hospitalist, like 99% of what I do is deliver babies. That is my work, to help bring babies into this world safely. Of course, I am on the side of life. It's just that I know, and I have seen this happen time and time and time again throughout my 15 years of practice, that this is a personal decision. Women have the strength, women have the knowledge, women have the ability to make these decisions for themselves. And it's not something that the government needs to be a part of at all. All right, so that is it for this episode of the podcast. Be sure to subscribe to the podcast on Apple Podcast or wherever you listen to podcasts, Spotify, Google Play. And I would really appreciate it that if you enjoy the podcast, leave me a review in Apple Podcast in particular. It really helps the show to grow. It helps other women find the show. And of course, I love hearing your comments, and I give shout outs from those reviews on future episodes. And I would really love to hear your thoughts on this episode. I know this is a difficult topic, so we'll talk more about it in my free Facebook group, All About Pregnancy and Birth. You can find that group just by searching for it on Facebook, or it'll be linked up in the show notes. It's a great group, a supportive group, non-judgmental zone that will, of course, continue around discussions of this difficult topic. So head on over and check out that group. Be a part of it if you're not already. It's All About Pregnancy and Birth on Facebook. Now, next week on the podcast, I am talking about health coaching. I am actually a certified integrative health coach, so I'm going to talk a little bit about that on the next episode. So do come on back next week. And until then, I wish you a beautiful pregnancy and birth. Thanks so much for listening to this episode of the All About Pregnancy and Birth podcast. Head to my website, ncrcoaching.com, to get even more great info, including free downloadable resources on how to manage pain in labor and warning signs to look out for after birth. You'll also find information on my free online class on how to make a birth plan, as well as everything you need to know about the birth preparation course. Again, that's ncrcoaching.com, and I will see you next week.